American Warrior Radio, brought to you by AVET Project. Glenn, we started talking about the no-getters regarding Agent Orange exposure. Let's finish up that short list.
Yeah, the next one on the list that you'll see by definition of what it takes to get it rated will mean you're not going to get it.
And it's a mouthful.
Yeah.
Porphyria cutaneous tarda.
Oh boy,
Is that close enough?
You did a lot better than I did. I usually call it PCT.
Yeah, that works. So why can't they get that?
Well, here's the criteria. It's a disorder characterized by liver dysfunction, thinning and blistering of the skin, and the key point is that the reason you're not going to get it nowadays is it must be at least 10% disabling since the last day you're exposed to herbicides, or the last day you were in Vietnam or DMZ or Thailand, as the case may be.
So it would be futile to come into your office or otherwise and try and file a claim for that if you've just been diagnosed with it.
Right, unless you hit that criteria where you were diagnosed with it back then. And you know, I understand it's a pretty nasty thing. I don't know that you would still be with us to file the claim, unfortunately. And then the third one is acute and subacute peripheral neuropathy. And people get really confused about this one because there's peripheral neuropathy that's caused by diabetes. And diabetes,
pretty common, actually,
yeah,
right?
Yeah, and diabetes is one of the ones we're going to cover as a no-brainer. But this is a different kind of peripheral neuropathy. It's a nervous system condition that causes, like all neuropathies, numbness, tingling, and motor weakness. Under the VA rating regulations, pay close attention here. This is why you're not going to get this nowadays. It must be at least 10% disabling within 1 year of exposure to herbicides, read the last day you were exposed, and resolve within 2 years of that date, and then come back many years later. Well, I don't even think, from what I've read up on, that the medical folks even made those kinds of diagnoses back there when we were in Vietnam, involved in Vietnam in the 60s and 70s.
So that's a no-getter. Not going to happen.
Yeah, that's a strikeout.
Okay, now we get to the good stuff. These, well, I say good stuff in that these are compensable service-connected disabilities secondary to exposure to Agent Orange or other herbicides.
Right.
These are the no-brainers, you say.
The no-brainers, and the percent you get is going to depend on how severe it is currently. But the main thing is you're going to get service connected for these.
Now, you're making a big statement there. They are going to, if they have boots on the ground, and their DD-214 states that, and they have this diagnosis,
you're going to get it.
Cool. That sounds like a no-brainer to me.
Yep.
Let's hit that list.
All right. And I don't wish any of you to be afflicted with this, but you need to be armed with the information that if you are, you need to come see us and get a service-connected disability approved.
Folks, that's why we're here on American Warrior Radio, to give you the straight scoop on what's important to you and how it can impact your life in a positive way.
Absolutely. And the first one is amyloidosis. That's a rare disease caused when an abnormal protein, amyloid, enters tissues or organs, and that's a pretty nasty thing because it eats your organs from the inside. So that's,
oh my!
I don't think that's one with a long lifespan if you unfortunately become afflicted with it. And let me say at this point, unlike those three no-getters, these no-brainers don't require that you meet any of that kind of criteria. You just have to have a diagnosis currently that you are afflicted with one of these.
Okay, so you've got boots on the ground based on your DD-214, and the doctor has written a progress note that reflects one of these conditions we're talking about. And the first one, amyloidosis, is a no-brainer because they know it's connected.
Yeah, exactly. It's on the list, and the VA presumptively will approve that as a service-connected disability, so as will all these on the list we're covering now.
It's simply a matter of them determining the severity of how it's affected you, right?
That's right. And that's based on a rating table that has specific criteria for awarding 10% or 20% or what have you.
Understood.
Okay. Second one is chronic B-cell leukemia. That's a type of cancer which affects your white blood cells. That, a little confusing, that's been on there in a limited form for a while, and then back in 2010 when they added the three new ones,
sure,
that was all encompassed in the old one was encompassed in this one. So you may also hear this called hairy cell leukemia.
And leukemia is nasty, folks. Everything on this list is nasty.
Oh, yeah.
And more than potentially life-threatening. It could take your life. So you must listen to what Glenn's saying. And if you're affected or know somebody that's affected, get in to see him or get with the VA and file a claim.
Exactly. And the next one is probably one of the more common ones, and that's diabetes mellitus type 2. And, of course, that is a very insidious disease in that it causes you many other problems, or can cause you many other problems. It can cause you vision problems, kidney problems.
Those neuropathies you mentioned?
Those neuropathies I mentioned. And all of those can also be approved if you're approved for the diabetes mellitus secondary, if your doctor will say that the diabetes is the cause factor for your diabetic retinopathy, that's your eye problems or the kidney problems or the neuropathies and others.
And that's a really important point you just made. So if you've got the diagnosis of diabetes, whether you're insulin dependent or just taking a pill for it to keep it at bay, but you've got some of these additional disorders you just mentioned, they're independently service connectable.
That's right, all on their own as being caused by a service connected disability that you have.
And let's break it down. That means more money, more compensation.
Oh yeah, absolutely.
Very good.
And also, priority treatment for anything you're service connected for in the VA healthcare system.
Fantastic. Next on the list.
Next on the list is Hodgkin's disease.
Gosh, I don't like the sound of these diseases.
Yeah, I don't either. It's a malignant lymphoma, cancer, characterized by progressive enlargement of the lymph nodes, liver, and spleen, and by progressive anemia. So, you're tired and worn out all the time. Nasty thing. Another one of those that in many people you don't have a long lifespan once it's diagnosed that you have been afflicted with Hodgkin's disease. Then there comes ischemic heart disease, which is one of the new ones that we've talked about for a while. And ischemic heart disease is easy to understand, is most any heart problem that you are diagnosed with except a valvular heart disease. If you're diagnosed with a heart valve problem, it doesn't qualify. Any coronary artery disease and all those other things does qualify. However, hypertension does not, and this does not lead to hypertension. So there's been some confusion about that. Okay,
so ischemic heart disease is potentially any heart ailment disorder other than the valvular, which is oftentimes congenital, or hypertension.
Right.
Okay, I think we got that clear.
Okay, and then there's multiple myeloma, which is a cancer of the plasma cells. Boy, it sounds like Star Trek here. A type of white blood cell that's in your bone marrow. And you've got generally a lifespan of about 5 years, although I did know one client who sought out some what do you call it, experimental treatment, and that lasted for about 12 years. I don't know how much that person paid for all this because it was all overseas. It was not stuff approved and to be administered in America under Federal Drug Administration rules. So,
well, the multiple myeloma, again, a nasty disease, but if you have it,
it's a bone cancer. Easy way to understand it.
I like it. I like it keeping it simple here.
Yeah. Then there's non-Hodgkin's lymphoma. Remember, we already talked about Hodgkin's disease. Non-Hodgkin's is a group of cancers that, again, affect the lymph glands or other lymphatic tissue, but it's different medically than Hodgkin's disease. So if you got any of the Hodgkin's group, A, you're not in good shape, and B, it can be service-connected. Then Parkinson's disease, and that's one of the new ones that's been added last year in October. And of course, Parkinson's disease is a progressive disorder of the nervous system that affects muscle movement, and people who've maybe been associated with folks that have been diagnosed with Parkinson's disease have an idea how debilitating it gets, and it's progressive, as I said. It gets worse as time goes by.
But the nice thing about a couple of these is they're expanding the treatment options and the availability. Even though you may not make it through, the other side, it's important to file your claim and stick with your doctors, because just like in Parkinson's, they're coming out with new treatment modalities and therapies all the time.
Absolutely. There's every day I think there's a possibility of more hope for almost anything medically, the way things are going. Plus, don't forget that if your service connected for these, that makes it easy for your survivor to get dependents indemnity compensation, which is a survivor benefit of $1,154 a month.
That's incredibly important, because if we've got Vietnam vets out there that, even though they know they've got one of these diagnoses, the doctor has said, you're not going to make it past 5 years or less,
right,
whatever it might be. If they don't want to file a claim for themselves, it's vitally important they do it anyway, because their surviving spouse and dependents will be eligible for that DIC you talked about.
You bet. And then next up on the list is prostate cancer, which is one of the more common types of cancers that men get, especially when they get older. But there's a much higher incidence of people who've been exposed to herbicides / Agent Orange of getting that than the general population. So
it kind of parallels all of the public awareness for breast cancer in women.
They're good analogy, very good analogy.
The prostate cancer for men is pretty widespread in population, the aging population anyway.
Correct.
But this population, our Vietnam veterans who had boots on the ground, suffer a much higher incidence of this.
Right, exactly. And then is respiratory cancers. That's generally found in the form of a lung cancer, but it can also be any part of the respiratory system. One thing, unfortunately, run into, and VA's not chosen to recognize it yet, and that's esophageal cancer, which is up there in the same part of your body as the respiratory system. But if it's esophageal cancer that you're diagnosed with, that doesn't come under the VA's definition of respiratory cancers. Mm-hmm. Lung cancer is the big one, and there's some others. So ask your doctor if you got a cancer and you're unsure if it's part of the respiratory system. Your doctor knows.
For sure. One other item on that list.
One other item is soft tissue sarcoma. Now there's a whole list of the different types of soft tissue sarcoma that are recognized. What you have to remember is sarcoma is the key word. That's a different kind of a cancer process than melanoma. And a lot of people have melanoma and think that fits under the sarcoma.
Which it doesn't.
And they get disappointed because the claim is denied on them. So those are the no-brainers to the no-getters, or the other way around as we presented it, the no-getters to the no-brainers. The bottom line is, if you were in Vietnam, or if you were in Thailand,
or one of the ships they've recently added.
Yeah, they've got a list now of about 40 or 50 ships and boats that are added to the list. Check it out with us and let us find out for you what's going on. We may have to send you to your doctor to get some confirming information, but you get started in the right direction. Because remember, we're there to maximize your opportunity to get a claim approved that you've earned through service to our country.
And there is such a large number of veterans out there that don't even know these benefits are available. They may be suffering these horrible illnesses and diseases right now, and they don't even know that they're due compensation on a presumptive basis.
Exactly. And one other myth you need to throw away is, well, I'm not going to put in for it because I'm doing okay now, I'm financially all right, and it'll be taking it away from somebody else. It doesn't work that way, folks. You're not taking it away from somebody else. You earned it yourself. And to my knowledge, the government never quits putting money into the compensation pie to pay everybody that's service connected and entitled to monetary benefits.
So set aside that bravado or modesty or whatever it might be.
Whatever thought process you've got that it'll take away from somebody else.
And think of it like this, in the terms of our government and the way the government operates. If the money doesn't go out, because I know, and you and I, I'm sure, can agree, there is countless thousands, if not tens of thousands, maybe even 100,000 veterans out there that are eligible and would be on this list and getting compensation right now if they'd simply take the time to file the claim.
Absolutely. That's why you might have detected a note of frustration at the first when I said I need to cover all of these again, because we keep running across people who have just heard about it. I don't know where they've been at, not associated with veterans groups and that kind of stuff, I suspect, and you know.
And it's important that we mention right now for all of the audience what a veteran is. Glenn, what's your best guess in a conversational tone? What is a veteran? Who qualifies as a veteran?
Well, a veteran is anybody that served their enlistment honorably or had to get out early because of medical or hardship reasons. And it's not military. What it's not is a military retiree. Conversely, a military retiree is a veteran, but lots of people out there for some reason think you have to be a military retiree to be a veteran, and that's not true. You did your 2-year term.
That's right.
You're a veteran.
If you were honorably discharged.
You did a year of the 2-year term and you had to get out for a hardship discharge because of family issues, you're a veteran.
And you don't, and I'll stretch this a little bit further, you don't necessarily have to have an honorable discharge. Even somebody getting out on a general discharge is going to be eligible for specific VA benefits.
Correct. And, you know, if you have less than an honorable, the VA has a system where they can go through and make an administrative determination that enough of your service or the service during which you suffered the disability that you have was honorable at that point in time, even though the whole characterization on your discharge papers may say general or something like that.
So what you're saying in a nutshell is the Veterans Administration can make a decision independent of what the Department of Defense puts on your character of discharge and the blank on your DD-214.
Yes, and in fact they will if you have less than an honorable discharge. In most cases, for sure they will if you have something less than a general discharge.
So for all you Vietnam vets that may have had some interruption or something happen to you in service and you think, I don't have good paper, I don't have a good discharge, I wouldn't qualify, what's your advice to them, Glenn?
Come see us.
That's pretty sound advice.
Yeah, 633-2012 is our phone number. Again, that's 633-2012. We're out in Bravo Building in the County Government Center on the first floor. Just look for the signs that says Veteran Services with the arrows and you can't miss finding us.
And I want to mention right now, this is super important for all of you folks that are online. You know you can listen to American Warrior Radio live as it happens at 1300WMEL.com, but I want you to understand it's simple enough. Plug into the address box on your browser, www.avetproject.org. Go down to the bottom of the page in the left-hand corner, see the F, the Facebook icon. Click on that, and then boom, all kinds of neat information is going to become available, particularly under discussions. Under the discussions, you just click there, and you're going to get a series of information that we've disseminated to keep it simple. You know, if how many times have you gone to the va.gov website, and it's a sea of information?
You know, 5 years ago or so, they had a fairly decent, simple to navigate site. Now I can't even navigate the thing. I hardly use it anymore because I can't find what I'm looking for.
And this is coming from a career credentialed service officer, supervisor. So folks, what we do at AVET Project and American Warrior Radio is break it down to its elemental, fundamental parts so you can quickly identify the area that's of interest to you, and there's good information, not all this jibber-jabber.
Right.
To the point information that's important, and you can go from there as to see, you know, kind of give yourself a quick look whether you might be eligible, and then get a hold of Glenn.
Exactly, and let's throw in one more in that confuses a lot of people when we're talking about the definition of a veteran. reservists and guard people who have been federalized. They've been called to active duty, which happens very frequently nowadays because of the ongoing war. That if their 214 says completed the tour of duty for which recalled,
Guess what?
You're a veteran. And it doesn't matter if that turns out to be 30 days or 30 months. The length of time is irrelevant as long as that statement is there that you completed the tour for which recall for. And then you have entitlement to service-connected disability benefits. You have
all sorts of benefits.
Entitlement to VA medical care, particularly if you were if you were in a combat zone, then you're entitled to 5 years of medical care by the VA, no matter what your
Guard,
other
reserve,
situation is, no
whatever.
matter what your income is, your assets are, any of that.
It's important, folks, that you explore what might be available. If you don't, it's just going to go away. It's going to not be a part of your life. This is too vital information to let pass. If you're a Guard or Reserve member, and guess what? The latest number is 60% of our forward deployed forces are from the Guard or Reserve. When these guys and gals get back after serving honorably, particularly like you said in a combat zone, they got some serious benefits that are available to them.
Exactly, and it puts a new definition on the term weekend warriors. I think they're going to have to come up with some other acronym for our Guard and Reserve warriors out there.
But I got a question for you, Glenn. How much is your service? If I go into the County Veteran Service Office, I got to get my wallet out. How much I got to spend?
Our services are free. And in fact, nobody should be charging anybody for help with a VA claim. It's against the regulations and the law, and there is a new law being run around the halls of Congress right now, and hopefully it gets passed, which is going to put even more teeth into that law that you can't charge veterans to help file their claim for them. And unfortunately, we got a bunch of people like that are running around our county.
It is. It's unfortunate throughout the land. There are folks that are trying to profit off the backs of our warriors. It's not right, and guess what? As Glenn said, it's against the law.
Exactly.
We got to put a stop to it. Well, we've covered a lot of ground on these presumptive illnesses. I want to throw this out real quick. It's taken a generation, 35 plus years, to get to this point with the Agent Orange stuff. Shinseki, the new Secretary, Department of Veterans Affairs, has opened a door already for the warriors since 2001, 9/11, regarding environmental toxins and the adverse effects they may have on their health. If you know some of those warriors and they're suffering problems, you got to get in to see Glenn.
Yep.
And
we got any small inkling of a chance to file a claim, we will.
I want to share with the audience before we have to leave today, because I know we've covered a lot of ground, but there's some real neat things going on. When you get a chance, particularly if you can see this magazine online, WINC, W-I-N-C. It's a Women's Incorporated. It's a magazine that's wonderful, and it emphasizes the way women make an impact in the business environment. And the cover girl for the June-July issues happens to be none other than AVET Project's Executive Director, Kim Cohn. Wonderful article. Our Director of Events has an article in there. Even if you want to know about Hong Rawson, a longtime volunteer of AVET Project, pick up a copy of Wink Magazine. Jennifer Worski is the publisher, does an incredible job. We want to thank her for that, and we'll make that available on Facebook. AVETproject.org. Click on the Facebook icon.
And I think you're going to give me some of them for the office.
Oh, yes, for sure we are.
Oh, no, that's another book you're going to do.
Well, you're going to get some of the Wink magazines too.
Excellent.
Veteran-owned business right here in Melbourne is providing free copies of Tears of a Warrior. If you want to make a donation to the cause, that'll be helpful. But we're going to have them at your office.
And what's that book about?
It's about PTSD and the travels and travails of those that are suffering from it, including the family and how it impacts. Pretty good read. There's some pictures. It's kind of like a biographical sketch of how they dealt with it. It's going to be available at a couple places, and we'll share some of that information with you down the road. But we want to thank everybody for tuning in to American Warrior Radio today. Thank you to Vern and John here at WMEL and to AVET Project. And as always, Glenn,
don't forget, thank AVET.